Ngoreza Ma TV amu enang ena.
As long as all the congregants and worshippers are vaccinated, the Interfaith Council is urged to develop protocols to facilitate resumption of full congregational worship with full capacity of venues where all congregants are vaccinated. Kenyans are once again, and I repeat, encouraged to wear face masks while inside indoor functions. Sanitizing and hand washing should be made normal practice. All in-person indoor meetings to resume at full capacity of the venue as long as all participants are vaccinated. All attendees should be encouraged to wear face masks at the meetings venues as noted. Event organizers are required to ensure that this is followed as they will take up responsibility for events on which unvaccinated persons are present. It has been noted that majority of COVID-19 cases present themselves without fever. As such, the use of temperature screening at public spaces has literal utility in current epidemiological scenarios. In this regard, therefore, the practice of temperature screening at public spaces can be stopped. However, more emphasis should be placed on ensuring that in those places, hand washing and sanitary facilities are available. On sporting activities, the Ministry of Health issues the following guidelines. To the Ministry of Sports, for resumption of sports, protocols to be revised for spectators to be allowed back into sporting venues as long as they are vaccinated without masks. The Ministry of Education to develop and implement protocols to allow for full resumption of sporting activities in learning institutions. On the issue of quarantine and isolation of confirmed cases of COVID-19, all quarantine is to be stopped with immediate effect. This applies to both vaccinated and unvaccinated persons. Positive asymptomatic cases need not isolate but shall be observed for 5 cases and return to work thereafter without the need for further testing. The return to work after isolation for those who may have been symptomatic must always take into consideration the individual's clinical status. Only those patients declared well enough to work by a qualified healthcare worker should resume work. In terms of in-country transport, all passenger service vehicles, train and domestic air flight services may resume at full capacity. However, the passenger service vehicles, trains and air flight operators are to ensure that their staff are fully vaccinated, while all travelers should have their face mask at all times during the course of travel. In terms of the international travel, travelers who are fully vaccinated shall forthwith be exempted from the requirements of a PCR test. Children below the age of 15 are exempted in any event from this requirement. All eligible unvaccinated travelers arriving at any port of entry into Kenya must have a negative PCR test result conducted not more than 72 hours before departure, regardless of the route of entry. Those below the age of 5 years are exempted from this testing requirement. You realize, of course, that this would be a very rare occurrence, given the fact that in most countries, vaccination for travel is a condition. But unvaccinated travelers arriving at any point of entry for whatever reason shall be subjected to rapid antigen tests at their own costs of $30. Any person who tests positive on antigen test will be subjected to entry PCR tests at their own further cost of $50 and self-isolate. Travelers below the age of 5 years are exempt from this testing requirement. All travelers arriving at any port of entry into Kenya will be required to fill the locator form Jitenge platform. Truck drivers and and travelers from the East African community countries who are fully vaccinated will not require any other document, including the non-requirement of PCR tests. Unvaccinated truck drivers shall be required, however, to be in possession of negative COVID-19 PCR tests with a validity of maximum of 14 days prior to travel. Persons traveling out of the country will be required to abide by the particular travel, health, and COVID-19 related requirements for the destination country. On the issue of vaccinations, to date, we have managed to administer over 17.8 million vaccines across the country. We are, however, scaling up countrywide COVID-19 vaccination campaigns through a whole government, whole society approach, leveraging on national government agencies, county governments, faith-based organizations, and the private sector. It is only through these efforts that we are able to ensure a return to normalcy. Vaccination is a proven long-term solution to halting this epidemic. Fellow Kenyans, the measures that we have announced today may be reviewed at any time, and the Ministry of Health can administer ad hoc measures, including arrival testing based on prevailing pandemic situations and epidemiologic situation of the country of departure. Finally, as I conclude, I want to take this opportunity in a special way to thank our healthcare workers across the country for the selfless commitment and dedication that they have continued to show during those 2 years of this pandemic, and urge them to continue practicing the same. I also take this opportunity to appeal to our fellow Kenyans who have not been vaccinated to get vaccinated. I cannot belabor on the benefits of vaccination, but I want to appeal to you to consider the people whom you love and who surround you at all times, and whether indeed it is worth putting their lives at stake. We have enough doses of vaccines for all eligible Kenyans. I thank you. Kwa ufupi, tumesema ya kwamba kutoka leo hii kuvaa barakoa, amri ya kuvaa barakoa nje wakati watu wanatembea kwa mitaani ama wakati wako nje si lazima. Kutoka leo tumesema unaweza tembea bila barakoa ukiwa nje ya kule unafanyia kazi ama uwe nje ya nyumba. Tumesema ya kwamba Interfaith Council ama ile chama tuliunda ya kushughulika na mambo ya makanisa na mosques, tumewauliza pia washughulike na mambo ya kutoa masharti ambayo itatumika katika makanisa, lakini tumesema kutoka leo hii watu wanaweza kurudi makanisani na mosques vile walikuwa hapo mbeleni, ijapokuwa ni lazima pia tuendelee na kufanya chanjo. Kwa hivyo wale ambao wamechanjwa ndio wanaweza kuendelea bila shida zozote. Vile vile tumesema ya kwamba wageni wetu wale wanatoka nchi za Ulaya na kwingineko, watu ambaye wamechanjwa kutoka leo si lazima wawe wamefanywa test ya PCR ama test zingine zozote, wako huru kutembea, ijapokuwa ya kwamba wakati wanatembea vile vile ni lazima washughulike na kuelewa masharti ambayo imetolewa na nchi hizo zingine. Wale ambao wanatoka nchi zetu za Kenya kutembea Ulaya ni lazima washughulike, wajue nchi zile wanaenda ile masharti pia iko huko katika hizo nchi zingine. Lakini kwa sisi wa Kenya tunawasihi watu wachanjwe, ndio hii practice ile sasa tumeanza ya kutoa kila siku tunatoa sharti moja alafu ingine kesho, itawezekana watu wakiwa wanaendelea kuchanjwa. Kwa hivyo sisi tunafurahia ile kazi inaendelea kufanywa na wafanyikazi wa Wizara ya Afya na wale wengine ambao wanatusaidia sana gao hata mahospitali na kwingineko. tumesema ya kwamba ukiwa pengine unatembea kama iko pahali kama ni hospitali, ni lazima pia utumie barakoa. Lakini ukiwa nje si lazima uvae barakoa. Lakini sio kusema ati ukivaa barakoa ni shida. Wewe ukitaka kuvaa barakoa wakati wowote, hiyo ndio hata mzuri zaidi kuliko wao wengine. Lakini ni vile tu tunasema hatutaki mwananchi asubuliwe na polisi ama wengine ukiwa huna barakoa, ukiwa unatembea nje ama kwingineko. Na hayo machache nimesema asanti.
Ing'olitha Maa TV amu enang ena.